Hi! Good morning, good morning, good morning! So, we're back, and then we'll read nutritional requirements of pregnancy. So, hindi kayo, just listen. Nutritional requirements. Following the lifestyle program guidelines. Following the lifestyle program guidelines will give you a healthy diet to follow all through pregnancy. But you should check in particular that you are getting sufficient of the following. Protein. First, protein. Protein. Rule. Essential for embryonic growth. Embryonic growth. Recommended daily amount and the useful sources. So, with protein, which is the role is essential for embryonic growth, recommended daily amount is 50 grams in second half of pregnancy. Second half of pregnancy. So, useful sources. One stick of 2 eggs, one stick or 2 eggs, a large salmon stick. Strict vegetarians need to ensure sufficient through cottage cheese, tofu, fungus-based meat. Yes. Substitute lentils. Hmm? No, no. One stick or 2 eggs, a large salmon stick. Strict vegetarians need to ensure sufficient through cottage cheese. Cottage cheese, tofu, tofu, fungus, fungus-based meat. Substitute. Substitute. Substitutes. Lentils and pulses. Pulses. And may need protein supplements. Calcium. So next is calcium. Calcium. First protein, second is calcium. Saman. Mm-mm. Oo. Second is calcium. The rule is an unborn baby demands calcium for its growing bones and will, if necessary, steal it from its mother. So the recommended daily amount, kung sa protein, 50 grams in second half of pregnancy, sa calcium, ang recommended is 1.5 grams. Daily produce broccoli, fish, meat, and asparagus. Iron. Third is iron. Iron. Vital to blood productions. Too little causes anemia. Needed recommended daily amount is 50 milligrams. Useful sources: meat, fish, eggs, leafy vegetables, dried fruit. Then the fourth is vitamin C. Vitamin C. First, protein, calcium, iron, vitamin C. So the rule is for bone, skin, and cartilage development. Aids iron absorption. The recommended daily amount is 500 milligrams. Useful sources: leafy vegetables, sweet peppers, black currants, sweeter varieties of leafy vegetables, sweet peppers, black sweeter varieties of clementine, satsuna, satsuma, satsuma. Folate or folic acid, fetal development preventing spinal pivida. This is in prevention for the spinal pivida. Daily recommended amount is 400 milligrams. 400 milligrams. Useful sources: pulses, fortified breads, and breakfast cereals. Supplement usually recommended as diet, unlikely to yield sufficient for a pregnant woman. Zinc. It's zinc. General growth and development of immune system. So we really need this. So the pregnant women really need this. Zinc. General growth and development of immune system. 15 milligrams. So the useful sources is lean meat, whole grain cereals, nuts, and seeds. Magnesium, bones and nerves, and use of muscles. Recommended daily amount is 150 milligrams. Pulses, nuts, whole grain cereals. So the nutritional requirements for a pregnant woman is protein 50 milligrams, calcium 1.5 grams, iron 50 milligrams, vitamin C 500 milligrams, folate or folic acid 400 milligrams, zinc 15 milligrams, and magnesium 150 milligrams. Emotions. Here is an ancient saying: the baby eats what her mother eats, breathes what she does, thinks how she does, works when she does, rests when she does, emotes when she does, smiles when she does, cries when she does, hates when she does, and love when she does. Each of the emotion alters the state of the body and certainly affects the mind. The unborn baby cannot but react to its mother's state of mind. Stress, depression, and anger all adversely affect your body, and learning to manage them will not only make your life easier now, it will help you it will help with bonding and bring up your baby later. Ito meron na akong na-encounter talaga yung mga friends ko ganyan. Yung unang meron akong kakilala, yung friends, yung friend ko, yung close friend ko, nang nagbuntis siya, hindi pa siya kinasal. So, the initial reaction is parang tinatago niya yung nasa tiyan. So, hindi naman sinasabing hindi siya proud na preggy siya. But then, yun bang, dito kasi sa Pilipinas, parang pag buntis ka na hindi ka pa ikinasal, parang may may mga dami-daming sinasabi sa paligid. Bakit hindi pa kinasal, nabuntis na, ganyan, ganyan. So, yun yung magiging initial reaction ng ng mother. So, sa pangalawang baby is nakasal na siya nung time na yon. So, proud na siya na preggy siya for her second baby. Kaya yung development ng bata ngayon is yung first child is matalino siya, maganda, pero makikita mo talaga siya ng pagka-introvert kasi parang yun nga, yung nung sa baby pa siya, parang hindi din siya ganun ka-proud, yung mother. Pero nung yung pangalawa, maganda din at saka matalino. Pero nandun talaga yung confidence. So, kasi na siya um, proud na siya na preggy siya nung time na yon, yung time na binubuntis. So, yun nga, emotions really As the relaxation section of the lifetime program explained, relaxing is not simply doing nothing or sitting in front of the TV. Being able to consciously relax your muscles and switch off your mind will raise your threshold to stress. Saman, wala. There will be times during pregnancy and the birth when you were feel worried or nervous. Things may not go according to plan. You may feel out of control or that it is all too much. Relaxation techniques are a tremendous help at these times. You may find yourself more greatly affected by a stressful situation or news than you would normally be. Even events on the world stage or disaster movies can cause harmful agitation. Avoid them when you can. Pregnancy yoga exercises will increase your mental as well as your physical stamina and help your body react better to stress. Exploring the spiritual side of life can expand the resources on which you can count. I personally feel that prayer can provide a lot of inner strength. Each of the emotions alters the state of the body and certainly affects the mind. The unborn baby cannot but react to its mother's state of mind. Stress, depression, and anger all adversely affect your body, and learning to manage them will not only make your life easier now, it will help with bonding and bringing up your baby later. Harmful substances, smoking, alcohol, and recreational drugs retard fetal growth. De-addict yourself before you get pregnant, or do it as soon as you know about your pregnancy. Hypnosis, psychotherapy, and acupuncture are very useful. Sex advice. Although general advice is that you can continue to make love for as long as you are happy and comfortable doing so, I believe it is better to refrain from sex as far as possible. Sexual excitement brings turmoil to a woman's body when it should be in a state of calm. Where there has been a history of miscarriage, the spasm of orgasm can cause damage, especially in the early and late stages of pregnancy, and so sex is best avoided during the first and third trimesters. This is a time, however, to show a lot of mutual affection and love. Unsa man? Unsa man? No. Face mask lang. Massage. Asa? Health center? Ah. Karon siya? Karon na first na ana? Karon? Mm. This is the time, however, to show a lot of mutual affection and love. Massage, sweet words, touches and embraces, gentle kisses, and stroking are enjoyed best by women during pregnancy. And there are various ways a man can reach satisfaction without penetration. Talking through with your partner how you feel at different stages of your pregnancy is vital so that there is no loss of mutual understanding and cooperation. Unnecessary strain. This applies to both muscles and your internal system. Avoid sitting your legs crossed. Sit with your feet firmly planted and your knees slightly apart. A little inelegant but better for you. Or with legs flat and apart when sitting on the ground. Straining on the toilet. If constipated, take psyllium host or senna to ease the bowels. Over hot baths, overdoing domestic chores, enlist your partner or the rest of the family to do more than usual. Work in a small spills, allowing yourself time to rest in between. Avoid carrying heavy things. Checks and checkups. Once your pregnancy has been confirmed, you can expect to be called for regular checkups to ensure your blood pressure and weight are staying within naa. Ma'am, dili siya nag-work karon ng andi. Regular lang siya. Nag-error ang loob. Sir, 9? Ah, 445. Sir, 93524454441. Bali, 20. Yara, ano, siguro error ang globe. Masay mo, haan. Ah, o, nag-error pa siya, ma'am. Pakuan ko sa number, ma'am, be. Kay, kuan ako niya. 20 ang i-load. 09.
Ako ah,
Nag-error siya.
09352
Ah,
445
ah.
441.
Ang sa Gcash, pilay mo hang i-ano. Ah, okay. Eight. Yeah. Cellphone number 0995 053 6453. 2,160, no? 0995 053 6453. Nina Marie 21650. Sulod na? Ha? Oo, naan na.
Namay baligya ba yun dito, ma'am?
Walo. 2,210. Yara, ah. Tapos ang sa Paymaya, naka-online ka? Ato dito sa apps. Kato na ka sa apps. Then, ato ka sa ano, sa add money. Tapos, ato ka sa smart padala ano code. Ah, Abe. Ah, wala lagi.
May sarili gaya po niya.
Ah, ah. 903. 9. Magkuhan ko 15 ha. Ang customer service na ano, 15. 0916-610-9050. Ha? This is, this is siya i-cash out? Ay, kadali. Pwede sa? Ulo po. Hmm. Ah, thank you.
Singko-singko ra good. Ilang ko oras sa balikan.
2.
2 hours ang singko.
Hmm. Tara. Saan na ba tayo? Once your pregnancy has been confirmed, you can expect to be called for regular checkups to ensure your blood pressure and weight are staying within normal bounds and to check that your baby is developing at the right rate. You should also keep a regular check on yourself. Many women try to live their lives as closely as possible to their pre pregnant state, only their size forcing them to slow down in the final months. Take stock periodically and regularly ask yourself questions such as: am I getting enough good quality sleep, or is insomnia a problem? Is, is it time to give up work or to arrange easier hours? Do I have the energy to do all the things I feel I am committed to? Should I set new priorities? Am I finding life more of a strain? This often shows in short temper, snappishness, fatigue, and lack of concentration. Ask your family and friends for their honest opinions. Am I allowing myself time to think about the future, planning the birth and my impending motherhood? Becoming a mother involves a fundamental change to your life. So it helps to begin making mental adjustment during your pregnancy. Amniocentesis. Amniocentesis.
Ayo,
Saman.
ayo.
Saman.
Balik-balik ko na.
Kasulat na.
Wednesday yung ban ma'am. Okay na, ma'am.
Sige. Yan na lang ko ni hapon ha. Nadir ang sulat. Masanahan, ikuha ning mga coins kay maglisod ko coins. So, 700 din nakasulat. Walay,
Bago na isa ma'am. 5
ha?
Bago na. 5.
O pero walay cellphone, nga ludan.
Nadia ma'am. Wala papilihan mo ko.
1, 2, 3. Ihapon pa na ko niya ha.
Nadia, number.
Wala.
Ano na?
Walay papel. Walay papel. Wala, ang kuan ra, ang amount ra. Sulat na lang ko ma'am oh. Ha? Wala, jud ma'am. Ito? Wala, gihabo na lang ko ron.
Ma'am Alvin ang pangalan mo.
Why ko nagakuan sa kan. O nagakuan lang ko sa kanang mga note pero ang kanang mga name sa kuan wala ba ya ma'am? Kakuan ka kung say last number
Smart ma'am kay 0920 Kaloka 4 3160.
sa smart ni kanan. Smart. Unsa tong last ma'am?
160.
160 ang last.
Oo.
Kaning 0920-444-3160.
Oo.
700.
Ay ko ano ma'am, 500 lang ma'am, na 500 to ang tiin. Sa kalibo mo na ma'am.
700 lagi nakakuan ko sulat.
700 ang queens na may 300 ang
Okay.
sa kalibo na tanan. 320 man tong papel. Wala na si bayad.
Sige daw, kay lang.
Sa tiin ma'am, February 0995.
Kailang ha, ikuan sa nako ang sa smart.
Dali man ko ba kay aking anak man ko ba? Akong gilipat ba kung tuyo?
0920-444-3160. Bali,
500 naman sa
500. 500. So, 10, 20, 30, 40, 50, 60, 70.
Gamit na po nila naman mo.
Mm. One, two, three, four, five. Tapos, ang sa globe, ang sila sa itong sa globe, ma'am.
PM, 0995.
Kung saan sa TM, ma'am?
PM, 0995.
Unsay last ato niya? Ah, sige, 09, 95, ha? Sir, 995 tapos 2.
Ay, narito, dahil naman.
Oh, pero di na ako ginakuan kung unsa ang mga name.
Siguro mo po kung nag-work ako ma, kanaging semana.
Unsay date? Basta 0995 ang ano?
0995.
Dili 6842240, dili no. Arlene,
Ayun, Sigla.
nagpasulat ba ta ka din rin, ma'am?
Anong nakapanood lang po ma'am. Sinusulat na kasi pag
Ang kanila po imuhang smart akong nasulat. 443160.
kunti mula.
Ang TM wala. 09,
0995.
na 0995 diri 7043284 dili. Dili. Kanang 099580 26617 dili.
Siguro na. Isa nga date na ma'am.
November 3. 0995-802-6617. Napo isa din 0995-684-1968. Ha? Pero ang imuhang nakuanan kay 09952. Wala man diri ma'am ang 0995 tapos sunod kay 2.
Wala na po na tayo lista.
Nakoy lista dinhi katong dinhi pero ang katong kani listahan na ni sa tanan na nagpa-load. Oh. Kung kuan ma'am, send na lang sa kuha. I-text na lang ko.
Tama ka gyapon kay nang kuan number.
I-text na lang ko ka para ano, para sure ta. Kani nga number ma'am oh. Na diha.
Tawag ako sa TM, sa Smart na mag-load mo.
Oh, giload na nako ang sa Smart. TM na lang ang wala. Ah, salamat. 5-5 lang ano. So sorry, na-busy. Na-busy sa tindahan. Amniocentesis. Amniocentesis is a procedure used to screen for genetic disorders such as Down syndrome, such as Down syndrome. Down syndrome. Thalassemia, a blood disorder, cystic fibrosis, and sickle cell anemia. Because pregnancy carries higher risk in later life, particularly after the age of 40. Amniocentesis is considered routine for older mothers to be. The technique requires carrying out analysis of the amniotic fluid that surrounds the fetus, cushioning it for external injury. The fluid is collected during a precise surgical procedure that requires great expertise in order to minimize risk to the fetus. Pregnant women who might undergo amniocentesis are presented with a dilemma. If the results are positive for a disorder that will seriously curtail a child's quality of life, should they have an abortion? Abortions may follow after the procedure. 1 in 200 abortions may follow after the procedure, either through the parent's choice or because the surgical procedure itself can cause abortion. 8. Because the surgical procedure itself can cause abortion. If the decision would be to continue with the pregnancy irrespective of the result, then it is better to know and so be prepared. Or is it better not to have the test, which carries an element of risk in itself? These are not easy decisions, but need to be considered before agreeing to the test. So amniocentesis is kind of test. And medyo haba-haba na yung ano natin. So that's all for today. bukas or kaya Saturday, I'll be trying to do, gagayahin ko yung ano, or mas safe kung Saturday, yung pregnancy yoga, kung kaya ko siyang gayahin na nasa libro. For now, bye-bye! Be healthy always! Love you, love you.